Tuesday morning, I set out with my boyfriend, mom, and sister to meet my doctors. Although I had my whole entourage with me, it seemed very personal. You know, like almost like a date. Like a overwhelming, very fast series of dates.
Hi, I'm Rebecca. I'm going to be your intern this morning.
Okay.
So, according to the pathology report, cancer was found in both the 2.5 centimeter mass at 12 o'clock on the left breast and a left axillary lymph node.
But I'm sorry, I was told that the lymph node was clear.
Okay, well, not according to the path report. I'll have Dr. Cutter review just in case, and then you'll have 20 minutes with both doctors and a social worker. Have fun.
Fun? Waiting for Dr. Cutter, fearing that the cancer had spread to my lymph nodes, were some of the least fun moments of my entire life.
Hi, I'm Dr. Cutter. So, what seems to be the problem?
Well, it seems like I have cancer.
Yeah, I seem to be seeing a lot of that lately.
An occupational hazard of being an oncological surgeon, yes?
That it is.
So, your intern had a different read of the path report than what the navigator had initially told me.
In what way?
Well, did the lymph node test positive for cancer?
Yes. Right. Let me double check. No, it's negative. Sorry. I don't really mean to freak out my new patients that way. Sorry. Sorry. So, who's your oncologist?
Dr. Onco?
Oh, she's great. So, has she talked to you about treatment options?
No, I haven't met her yet.
So, I'm first up. Awesome. So, well, a woman your age will normally be encouraged to undergo both local and systemic treatment. Dr. Onco will talk about this.
Local treatment refers to surgery and radiation, both of which treat the site where the cancer began.
That makes sense.
Systemic treatment refers to chemotherapy and hormonal treatment.
So I'm going to need chemotherapy even though my lymph node came back clean?
Yes, because of your age and the size of the tumor, chemo will be needed. Now, most surgeons are going to recommend beginning with a local approach.
I recommend beginning with a systemic approach.
What are the benefits?
Well, starting chemo first means you're immediately attacking any cancer cells that may have spread from the breast. When you start with surgery, those cells continue to grow until after you've had surgery and you can begin your chemo. Also, when you do chemo after surgery, it's very hard to measure its effects because there's no tumor to analyze. Now, doing chemo in the neoadjuvant setting before surgery means you can actually measure its effects. It's also easier for me because then when I go in, the cancer's smaller and it could give you more surgical options.
What are my surgical options?
Well, let's have a look. Oh, yeah. You can pretty much do anything you want. Lumpectomy, where we just remove the tumor, that would be a good option for you.
Well, with a lumpectomy, I would require radiation afterwards, yes?
Yeah.
Additionally, lumpectomies have higher recurrence rates than mastectomies?
Sure. If you want, you can have a mastectomy. Remove all the breast tissue on the left side. Because of your breast size, we can do a nipple-sparing procedure. You don't smoke, do you?
Oh, no, never.
Good. I don't do nipple sparing on smokers. The nipples always fall off.
Oh my god.
Yeah, it's a mess. Don't smoke. But that's plastic's problem, that's not my problem.
So will I even need a plastic surgeon if I opt for the lumpectomy?
If you opt for lumpectomy, you probably will not need reconstruction.
Right now I'm leaning towards mastectomy. Possibly a prophylactic bilateral mastectomy.
Both breasts? That certainly is a choice that's in vogue right now, but with Angelina and everything.
Is it something you recommend?
That would be your decision. Have you been BRCA tested?
No, but my mother has and she tested negative for the gene.
Has your mother had breast cancer?
Yeah, 3 times. The first time she had a lumpectomy followed by radiation. Second time she did a mastectomy with a tram flap reconstruction. Third time mastectomy with implants.
So these are all procedures you're familiar with?
Yeah, but I never mind a review.
If you have a mastectomy, the 2 most common reconstruction options are tram flaps and implants. With a tram flap, we perform a tummy tuck and use the tissue from your stomach to reconstruct your breasts.
Well, tummy tuck sounds good. Here's my biggest concern. I'm concerned about loss of sensation. And then also, like, I'd sort of like to wake up from the mastectomy with my breasts already reconstructed. And then, of course, I'd also like them to look as much the same as possible.
A tram flap is likely to cause a loss of sensation in the donor site, the stomach, as well as in your breasts. But you will wake up from surgery with breasts.
Will they look the same as before?
Getting parity between breasts is never 100%, but natural breasts are never 100% even either. Staying the same size is also dependent on how much stomach tissue you have. For you, 1 breast should be okay. If you do opt for the bilateral mastectomy, it's unlikely you'll be able to keep your breasts the same size. They're just too small.
Here's the thing. I'm pretty sure I don't want the tram and then I want the implants, but I would like to wake up from the first surgery with breasts.
Well, as you know, if you choose implants, tissue expanders will be placed in the breast during the mastectomy. After the surgery, you will need to come in over the course of several months to have the expanders filled with saline, thus stretching the tissue, making room for the final implant. I have been able to place implants at the time of mastectomy, however, only when the patient was having a bilateral procedure, because of some training.
So I could have the implants at the same time as the surgery if I do the bilateral thing.
Possibly. If I can't place them at the time of surgery, you would have to have at least one of the surgery to place the implants.
Does Medicaid cover the additional cosmetic procedures?
Okay. In New York State, Medicaid covers reconstruction following a mastectomy, including reconstruction on healthy breasts required to achieve reasonable symmetry in a manner determined by the attending physician.
Great. So what do I have to do to qualify for Medicaid?
Okay. Did you bring your utility bill, your passport, social security card?
Yes, and yes.
Okay. I have a few questions about your household income.
My household is just me, and I've been basically unemployed since January.
Good to know.
So do you think I'll qualify?
I can't say for sure, but pretty much everyone with applications like yours gets in.
The good news is you seem to have caught the cancer early, but just in case, I'm going to order up a PET scan and a chest MRI.
When?
Well, if you decide to do chemo first, we should probably do it in the next week or 2.
So what are the advantages of doing chemo in the neoadjuvant setting?
Listen to you. You could be a doctor. Seriously. You should think about med school. I'd write you a recommendation. So, statistically, whether you do chemo before or after surgery, the odds of survival are identical. The main disadvantage is the psychological effect of having a tumor there while you're going through chemotherapy. A lot of patients just want it out.
What is the duration of chemotherapy?
Anywhere from 12 to 20 weeks, depending on the course that you decide on. Do you have any questions?
So many. But for now, just this one. Can I go to Russia? Tomorrow? We're going on vacation. It's only 5 days. I know it's weird. I totally understand if you have to say no.
Totally go. Have fun. I can't wait to hear all about it. До свидания.